Are you curious about Jardiance and its uses? In this comprehensive guide, we will delve into everything you need to know about this medication. Common uses of Jardiance. Jardiance is primarily used for the treatment of type 2 diabetes. This medication belongs to a class of drugs called sodium glucose cotransporter 2, SGLT2, inhibitors. It works by blocking the reabsorption of glucose in the kidneys, allowing excess glucose to be excreted through urine. By reducing the amount of glucose in the bloodstream, Jardiance helps to lower blood sugar levels and improve glycemic control. In addition to its role in diabetes management, Jardiance has also shown promising results in reducing the risk of cardiovascular events in patients with pre-existing heart conditions. Studies have demonstrated that Jardiance can decrease the incidence of heart attacks, strokes, and cardiovascular-related deaths. This makes it an attractive option for individuals with both diabetes and cardiovascular disease. Advantages of using Jardiance. One of the key advantages of Jardiance is its oral administration. Unlike some other diabetes medications that need to be injected, Jardiance comes in the form of a pill that can be taken by mouth. This makes it a convenient treatment option for many individuals, eliminating the need for injections and simplifying the medication regimen. Another advantage of Jardiance is its potential for weight loss. Some people with type 2 diabetes struggle with weight management, and certain diabetes medications may even cause weight gain. However, Jardiance has been associated with modest weight loss in clinical trials. This can be beneficial for individuals who are looking to achieve or maintain a healthy weight. Furthermore, Jardiance has been shown to have a positive impact on blood pressure levels. It can help lower both systolic and diastolic blood pressure, which is particularly important for individuals with diabetes as they are at a higher risk of developing hypertension. By effectively managing blood pressure, Jardiance contributes to overall cardiovascular health. Potential adverse reactions of Jardiance. While Jardiance is generally well tolerated, like any medication, it does have potential adverse reactions that need to be considered. The most common side effects reported with Jardiance include urinary tract infections, UTIs, and yeast infections. These infections occur due to the increased excretion of glucose in the urine, which can create an environment conducive to bacterial and fungal growth. It is important to be aware of the signs and symptoms of UTIs and yeast infections, such as pain or burning during urination, increased frequency of urination, and vaginal itching or discharge, and seek medical attention if they occur. Another potential side effect of Jardiance is dehydration. This medication works by increasing urinary glucose excretion, which can lead to increased urine production. This may result in an increased risk of dehydration, especially in individuals who are elderly, have kidney problems, or are taking diuretic medications. It is crucial to stay well hydrated while taking Jardiance and talk to your healthcare provider if you experience symptoms of dehydration, such as increased thirst, dry mouth, dizziness, or reduced urine output. Rare but serious adverse reactions associated with Jardiance include ketoacidosis and genital infections. Ketoacidosis is a potentially life-threatening condition characterized by high levels of ketones in the blood. It can occur in individuals with or without diabetes and may present with symptoms such as nausea, vomiting, abdominal pain, confusion, and fruity scented breath. Genital infections, particularly in males, have also been reported with Jardiance use. It is important to be vigilant for any unusual symptoms and seek medical attention if needed. Dosage recommendations for Jardiance. The recommended starting dose of Jardiance is typically 10 mg once daily. However, your healthcare provider may adjust the dosage based on your individual needs and response to treatment. It is important to follow your doctor's instructions and take Jardiance as prescribed. Do not exceed the recommended dosage without consulting your healthcare provider. Jardiance can be taken with or without food. It is important to take it at the same time each day to maintain consistent blood levels of the medication. If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double up on doses to make up for a missed one. Safety precautions and hazards associated with Jardiance. Before starting Jardiance, it is important to discuss your medical history and any pre-existing conditions with your healthcare provider. Inform them if you have a history of urinary tract infections, yeast infections, kidney problems, liver disease, or any other significant medical conditions. This will help your doctor determine if Jardiance is a suitable medication for you. Jardiance is not recommended for use in individuals with type 1 diabetes or diabetic ketoacidosis. It is also important to inform your healthcare provider about all the medications you are currently taking. including prescription drugs, over-the-counter medications, and herbal supplements. Certain medications may interact with Jardiance and affect its efficacy or increase the risk of side effects. Pregnant women or those planning to become pregnant should consult with their healthcare provider before using Jardiance. The safety of this medication during pregnancy has not been established, and it is not known if Jardiance passes into breast milk. It is important to weigh the potential benefits and risks with your doctor if you are pregnant or breastfeeding. Jardiance compared to other diabetes medications. Jardiance is just one of several treatment options available for individuals with type 2 diabetes. It belongs to the class of SGLT2 inhibitors, along with medications such as Invokana and Farxiga. While these medications share similarities in their mechanism of action, they may have slight differences in terms of efficacy, side effects, and dosing regimens. Your healthcare provider will consider various factors, such as your medical history, individual needs, and lifestyle, when determining the most appropriate diabetes medication for you. It is important to have an open and honest discussion with your doctor to find the best treatment option that aligns with your goals and preferences. Frequently asked questions about Jardiance. Can Jardiance be used as a standalone treatment for type 2 diabetes? Jardiance can be used as a monotherapy or in combination with other diabetes medications, such as metformin or insulin. Your healthcare provider will determine the most suitable treatment plan based on your individual needs in response to therapy. How long does it take for Jardiance to start working? Jardiance typically starts to lower blood sugar levels within the first week of treatment. However, it may take several weeks to achieve optimal glycemic control. It is important to monitor your blood sugar levels regularly and follow up with your healthcare provider as directed. Can Jardiance cause low blood sugar, hypoglycemia? Unlike some other diabetes medications, Jardiance is not associated with a high risk of hypoglycemia. However, it is still possible to experience low blood sugar while taking Jardiance, especially if you are also using insulin or other medications that can lower blood sugar levels. It is important to be aware of the signs and symptoms of hypoglycemia and take appropriate measures to manage it if it occurs. Can Jardiance be used in individuals with kidney problems? Jardiance can be used in individuals with mild to moderate kidney impairment. However, it is not recommended for use in individuals with severe kidney impairment or end-stage renal disease. Your healthcare provider will assess your kidney function before prescribing Jardiance and adjust the dosage accordingly. Conclusion: is Jardiance right for you? Jardiance is a medication that offers several benefits for individuals with type 2 diabetes. It not only helps to lower blood sugar levels but also has the potential to reduce the risk of cardiovascular events in patients with pre-existing heart conditions. Its oral administration, potential for weight loss, and positive impact on blood pressure levels make it an attractive treatment option for many individuals. However, it is important to be aware of the potential adverse reactions and hazards associated with Jardiance. Yeast infections, dehydration, ketoacidosis, and genital infections are among the potential side effects that need to be considered. It is crucial to discuss your medical history and any pre-existing conditions with your healthcare provider to determine if Jardiance is the right medication for you. Remember to follow the dosage recommendations provided by your doctor and take Jardiance as prescribed. Regular monitoring of your blood sugar levels and routine checkups with your healthcare provider are essential to ensure optimal glycemic control and minimize the risk of complications. If you have any concerns or questions about Jardiance, do not hesitate to reach out to your healthcare provider for clarification.